Good afternoon. I'm Adrian Dix, BC's Minister of Health. Beside me is Dr. Bonnie Henry, our Provincial Health Officer for British Columbia. I just want to let members of the media and the public know that we will be doing a briefing tomorrow, Saturday. It'll be here and it'll be at noon. I want to acknowledge the territories of the Musqueam, of the Squamish, of the Tsleil-Waututh, where we're giving this briefing today, and I wanted to introduce our Provincial Health Officer, Dr. Bonnie Henry.
Thank you, and good afternoon. So today we are announcing that we have 77 new cases tested here in British Columbia for a total of 348 people. This includes 200 in Vancouver Coastal Health, 95 in the Fraser Health Region, 30 in Vancouver Island, 19 in the Interior Health Region, and 4 in the Northern Health Region. Of those, 22 people have been hospitalized, are in hospital at the moment. 10 of those people are in ICU, and 6 have now recovered fully from this disease. I did want to talk as well. We have a couple of long-term care facility outbreaks, including in our numbers a new healthcare worker who's identified associated with the Dufferin Care Centre, and that centre is now being managed as an outbreak, as we do whenever we detect a case in a healthcare facility. So Fraser Health is addressing that issue today. In talking about healthcare workers, I think that is something that is always in the back of our minds as we've been going through this last number of weeks. And I do want to say that we have had a number of healthcare workers who have been infected with this virus. And today I really want to talk about my colleagues. I know how challenging it is when we are dealing with a new virus, a virus particularly for which we have no cure, we have no vaccine, we have no way of preventing it, and we know that it can cause quite severe illness in people that we love and people that we care for and people that we're close to. And it's been a tremendous challenge for our healthcare sector to watch what has been happening over this last few weeks and months around the world. And I have been watching with them very, very carefully and looking at what are the things that we need to do to best protect our healthcare workers and our healthcare sector here. And I want my, and so much, of course, in the beginning is very unclear. But I do want to say we do know so much more now about this virus here. And we know that hundreds of people have been safely cared for by our healthcare worker teams here in Vancouver, here in BC, here in Canada over the last few months. And we know that they're safely cared for because of the dedication and the intense practice that we have in our healthcare worker system. We know as well that about 24 of our healthcare workers here in British Columbia have been affected with this virus. And I'm relieved and happy to say that none of them have had severe illness. All of them have had very mild illness, and there have been some very short hospitalizations, but for the most part, people have been managed at home, and that is something that we're grateful for. It is everything that we do in the healthcare setting that keeps us safe from this virus. And these are things that I've talked with my colleagues many times over the last number of weeks. It's identifying cases early, and we've seen that around the world. It's when we have unrecognized cases that are in a hospital or in a care home that it gets transmitted. And that's when people can get sick, and that's when it gets passed on to others. It's making sure that we have administrative processes in place so we minimize the people that are in contact with somebody who's sick. We make sure that as soon as you go into the hospital, and we talk about this a lot, about the importance of calling ahead, and as soon as you go in with respiratory symptoms, you're given a mask to prevent you from putting your droplets out there, prevent other people from being exposed. It's the engineering things like putting someone in a single room, like making sure we have the right air exchanges in our hospitals and our settings. And of course, it's the personal protective equipment that healthcare workers wear that protect them as well. And I know there's been a lot of angst and a lot of concern that we're not going to have the supplies that we need to best protect our healthcare workers across the spectrum, whether it's in the pre-hospital care, in home care, whether it's our community physicians, whether it's our hospitals, our long-term care homes. And I want to say that right now we have been working on this across the province and across the country, and we do have the supplies that we need right now. And we are committed to doing everything that we can to make sure that we continue to have what we need to best protect everybody in our healthcare system right now. And that's my personal commitment as well. Finally, I do want to say a little bit about the fact that we have had these social distancing measures in place. We've had gatherings that have to be curtailed, but we do need to make sure that we still have the resources that are available to support us. We need businesses to support our healthcare workers in particular. Make sure we have food. Make sure we have childcare, and details around our childcare strategy to support our essential workers will be coming out very shortly. But we also need to make sure that that there is appropriate precautions that are taken in certain settings to make sure that we are not allowing settings that allow transmission of this virus. And we go back to the reasons that we're doing this. The reason that we're doing this is so that we can build a firewall. We can prevent transmission of this virus between us, so that we can prevent the people that are the most susceptible to having severe illness or dying from this disease from being exposed to it in the first place. And that's the reason why we're doing all of these very extreme measures in many places. And it's become clear to me that there are certain settings where this is really a challenge. And we talked earlier about restaurants, and we put in some guidance around being able to maintain a distance within the restaurant. And it is becoming obvious, as it has to many of the municipalities around here, that this is a very challenging thing to do. So from today, my order is that restaurants must move to a takeout or delivery model only, as a way to best protect us and to ensure that we can maintain those distances. I also say that, for many businesses, they can and should stay open to support us, but they need to have the important social distancing measures in place to ensure there's not that many people in the office environment, for example. There's not face-to-face meetings. There's not congregation in groups. It's also important, and I've talked about this, for us to go outside. But like we do when we're inside, we need to go outside with our close family, with our small groups. We're not to be outside in groups. We're not to be out playing basketball. We're not to be out sitting together in large groups on the beach, watching the beautiful sunsets that we have. Because when we're out in groups like that, the chances are that somebody will be exposed to this virus, and then we'll bring it home to our family and our communities, and that is what is going to spread the virus. So right now, and again, this is not forever, but right now we need to be in small groups. We need to be with our family. We need to be with our close friends, one or two of us. And we need to maintain our distance with others. We must be united in these efforts, and we need to build that firewall and make sure that we keep it as strong as we can and that there are no gaps.
Thank you very much, Dr. Henry, and I wanted to just lay out a couple of things that have changed and some new information that people have been asking for that I think people will be interested in. As Dr. Henry has said, 77 new cases today for a total of 348 province-wide. To put that in context, 22 of those cases are in acute care. That's compared to, or in hospital, compared to 17 yesterday, and 10 are in ICU, compared to 9 yesterday. And I just want to put in context for a moment. 2 weeks ago, the Premier and Dr. Henry and I laid out our pandemic preparedness plan. We had been at stage 1 in dealing with acute care hospitals in terms of preparing them and opening up space. And this Monday, we went to stage 2 with the cancellation of non-urgent elective surgery. I just want to briefly report out how significant these actions have been and what they've meant and what they mean in the system. Prior to the COVID-19 response, we averaged about 103.5% capacity in our acute care system. That capacity as of now, our snapshot as of today, is 78.5%. That's a change in occupancy in a very short period, and in particular this week, of 25%, or 2,398 beds. In addition, our critical care beds are at 61.8% capacity. And I just want to put this in context because there's a lot of discussion of what people are doing in terms of preparing. But I think in terms of preparedness, as I just said, 22 patients currently in acute care. Just to put it in context, this preparedness is not what happened in other jurisdictions, and this shows how much we've learned from other jurisdictions. We've acted, and our actions have had consequences for a lot of people, as you can see in these bed numbers. But we've acted now to ensure that our acute care sector, that our hospitals are more prepared for a possible surge or influx of patients. And this has required extraordinary effort by everyone in the acute care sector, and I wish to thank them. We released and published this morning, I believe, on the BC CDC website, the testing numbers for this week, which I believe are 17,912. I want to echo what Dr. Henry said about the healthcare sector, about healthcare workers, that we must do everything possible to support our frontline workers in hospitals, long-term care, the entire healthcare sector, to give them confidence that they can do their jobs with the lowest possible risk of their health and well-being. Frontline staff are critical to beating this virus. They are critical to beating this virus. I know all British Columbians support this goal, and I want to say this directly to doctors, to nurses, to care aides, to those who keep our hospitals clean and safe, to food support workers and everyone else on the front line. We are grateful. We are enormously grateful for all your efforts. We're making headway together against this threat, but we're far from prevailing. Everybody knows that. But we also know, Dr. Henry has said it, that you're performing miracles every day. I want to make it as clear as I can. We're going to spare no effort to ensure that you have the equipment you need to get the job done, including the equipment to keep you safe. We do have supplies in place, and we're identifying more. We will, of course, respect your collective agreements and do what it takes to provide the additional support, childcare, and extra accommodation to help you work effectively. We'll track down and punish anyone caught misappropriating, the better word is stealing, the supplies we need for your protection. But our healthcare system doesn't exist in a vacuum. It needs support from every part of society and every part of the economy, and those essential services must continue. They cannot be shut down. They're equally critical to beating this virus. Of course, we know, and we've said it, and everybody understands how important care aides and nurses and doctors are. But so are pilots flying test kits to labs, early education workers caring for our health workers' kids, grocery workers making sure we're all fed, and longshoremen moving critical supplies across the dock. We are grateful for your work, too. It must continue under safe conditions, and we're taking additional steps to clarify the conditions under which important work can continue, both in healthcare and the wider economy. We'll have more to say on this shortly, but we'll be calling on employers, unions, and WorkSafe to develop the protocols under the supervision of Dr. Henry to give those working in the economy the confidence they are doing so safely. Of course, in addition to this, and Dr. Henry has made it clear with respect to restaurants, and I've had occasion to talk to a number of mayors, including the Mayor of Vancouver today, clarity about restaurants and the fact that they can only operate under a takeout basis. I want to say this, there's lots of discussion about all of the group of people that may not be following Dr. Henry's orders. It's our expectation that we all do so. It's what we owe to one another, and we must continue to do that. I want to say a couple of extra things. Yesterday, we convened Isabel McKenzie, the seniors advocate, staff of the Ministry of Health, and MLAs from all parties, including Shirley Bond and John Yap, who are Liberal members, including Ronna Ray Leonard and Janet Rutledge, who are NDP members, and Sonia Furstenau, the Green Party House Leader, to work together to build on the groundswell of community goodwill that is out there to support seniors. They've come back and reported with recommendations that working and using in alliance with Better at Home and the United Way to make to support seniors who are currently dealing with the consequences of social isolation necessary to protect their health. We'll have more to say about this on Monday. Sunday, but I want to thank all the members of that committee and the actions that they have recommended are being put into motion. Finally, I just want to say we are all in this together, and today we're going to find more ways to be all in the fight, and tomorrow we're going to find more, and we need everyone to join us. We've said it before, but we need to say it again and again and again, not just in settings like this, but to one another, that we know, because Dr. Henry has laid it out, some of the toughest measures anyone has seen that are required for all of us to keep each other safe. Some of it is simple: soap and sleeve and social distance and self-isolate and stay home when you're sick and support seniors and elders and those who are vulnerable. But starting now, there's no longer any room for almost or pretty good or nearly enough. Starting now, our individual fight, our collective fight must be 100% all of the time and 100% of the effort and 100% right. I know it's a lot to ask of a lot of people. I know people don't get the information all at the same time, but we need to give our healthcare workers, our healthcare professionals, Dr. Henry, our whole team of people around the province who are preparing to deal with the health consequences of this virus. We need to give them the flattened curve they need to provide the continued service and the continued care that will help everyone in the province. Right now, and every moment from here on, going all in on COVID-19 will save lives and our own lives and those of the ones we love. It's just that simple. Nous annonçons 77 nouveaux cas de COVID-19 aujourd'hui, pour un total de 348 cas en Colombie-Britannique. Parmi les nouveaux cas, un réside au Dufferin Care Center, un établissement de soins de longue durée à Coquitlam. Les équipes de santé publique et de contrôle des infections à la régie de santé de Fraser sont sur place. Chaque régie de santé en Colombie-Britannique compte maintenant des patients atteints de COVID-19. 200 sont dans la régie de santé de Vancouver Coastal, 95 à Fraser, 30 sur l'île de Vancouver, 19 à l'intérieur et 4 au nord. De plus, sur le total des cas de COVID-19, 22 personnes sont actuellement hospitalisées. 10 sont en soins intensifs et les autres patients sont à domicile isolé. We're ready to take your questions.
Thank you, Minister Dix. And to the media on the phone, a gentle reminder that we will be taking only one question. Yet another reminder to the media, please be on unmute mode. You are not audible until your name is called. The first questions will be from Richard, followed by Nick and Andrea. Richard Zussman, go ahead, please.
Thank you very much. I'd like to, there's some feedback there, but I'm still going to ask it. For Dr. Henry and Adrian Dix on housing issues, we're hearing from people who have been given eviction notices, they believe in connected to COVID-19. Either they're staying at home in self-isolation. In one case, someone has a boyfriend with them and that breaks the rules and have been given an eviction notice. Will there be any protection to them? And also we're hearing cases of open houses still taking place. In some cases, Dr. Henry, is that a practice that should continue? And lastly, we're getting a lot of questions on our Facebook Live to you, Dr. Henry. You're speaking about the work health officials are doing, but people are hoping that you're well and that you have the rest you need. Do you think there will soon be an opportunity for you to at least get a little bit of rest?
Thank you. That's very sweet. I'm hoping that we'll have a day of no media on Sunday. But this is something that we're all committed to, and I'm not the only one. I'm the face of a whole team of people who have been working around the clock for a long time on this, and will continue to, because it is just so important. And we have seen, particularly in the last week, how it's affecting all of society here. And we have to continue to do that. In terms of open houses, I think there's businesses that can and do need to continue to move on or to continue to work and to be open around this crisis. And there's people that are relying on being able to sell their home to be able to do other things in their lives. However, it has to be done in a way that protects the safety of everybody. So that means that would have to be a one-on-one, and you'd have to be able to maintain distance. So as long as those parameters can be put in place, I think it is safe for businesses to carry on certain functions. And I don't have the answer to the eviction question.
In principle, there shouldn't be any evictions due to COVID-19. Richard, I'd be happy to get the information from what you're getting, and I know that people involved in the housing ministry will have things to say about that. So we'll get you more information on that, but in principle, that shouldn't happen. It's hard to resolve cases that come forward in this venue, but I would say in principle that we shouldn't be evicting people at this time.
Thank you. Nick, next question is from Nick. Go ahead, please.
Hi, Dr. Henry. You've been very clear about restaurants and bars and the course that they should be taking. What's the direction for other non-essential businesses that can have hundreds of staff working in one place? And what's the recourse for concerned employees who may be working for a company that's not doing the best practices?
Right. So as I've said, there are many businesses that can and should stay open. We want to make sure that we have the economy to be able to support both the healthcare workers and the rest of us to be able to get the food we need to keep the lights on. There's many, many reasons. And part of that is, some businesses supporting people in continuing their work and being paid so that they're able to do these work. So it's not trying to shut down everything that is important. But what is important is the reason we're doing this is not just to keep people off business. The reason we're doing this is to prevent transmission of the virus. So the principles behind it are to ensure that we're not congregating in places where people can be close together and be transmitting this virus. So businesses need to take the measures to make sure that it's done in a way that is safe and the way that it reduces the possibility for people coming in contact with each other and passing this virus. And there are many that can do it, and there's many that need to take extra precautions, like things like truckers monitoring your symptoms, monitoring yourself, your health every day, having an active monitoring program, making sure you're able to clean your hands, that you maintain space when you're around others. So there are things that every business needs to do, and the recourse is through their own HR management. And I go back to if we have transmission in a business setting, it affects that entire business, and that will be a long-term effect. So these are short-term things that people need to do now to try and build those distances in to prevent us from having those long-term effects and prevent your own business from having those long-term effects.
Thank you. Next question is from Andrea Wu.
Oh, hi, Dr. Henry. I was hoping you could just clarify how many residents and how many healthcare workers at the Lynn Valley have tested positive in total.
At the Lynn Valley Care Centre, there's been 36 residents who've tested positive, and tragically 8 of those people have died. We've had 18 healthcare workers from the Lynn Valley Care Centre who've been positive. None of them have been hospitalized. All of them are doing well, and many of them had very mild illness.
Thank you. Next questions will be from Srushti Gangdev, followed by Brishti Basu, and then Tanya Fletcher. Srushti, go ahead, please.
Dr. Henry, hi. I'm just wondering if there's any insight you can give about our case count versus Ontario's. It seems like we're kind of outpacing Ontario every day. We have a population of about 5 million. They have about 15 million. Are they doing a better job of stemming community transmission or flattening the curve than we are?
Yeah, very good question. I think the transition, our outbreaks are slightly different. We are, unfortunately, many of our cases are related to, as you know, the Lynn Valley Care Home and the other care homes. So we have clusters of cases. We also, have a number of community spread, as they do as well. So it's hard to compare. And it's a matter of the amount of testing we're doing as well, and the areas that are being tested. So I don't like to speculate. I think in any one day will be more or less than them.
Thank you. Next question is from Brishti Basu. Go ahead, please.
Hi, Dr. Henry. We're still getting a lot of questions from readers about why the communities or municipalities with confirmed COVID-19 patients are not being released. Can you just clarify why health authorities are citing patient privacy as a reason when they gave out details of patients with the measles outbreak earlier?
Yeah, so measles, as we know, is very different from this. And measles can be spread in the air after somebody has left the room. So we need to give people an idea of where they might have been in contact with it. We're not seeing that with this disease. I will say, however, and that was very much early on where we had individual cases and there was one or two people that could be identified in a community. We're now at the place, though, where it's irrelevant what community you're in. The risk of this virus is everywhere in British Columbia, everywhere in Canada. And that has been the evolution of this virus, not just in BC and in Canada, but around the world. So we cannot say, it doesn't make any difference whether somebody was in North Shore or in downtown Vancouver. We all need to do our part right now to take these measures to prevent transmission of viruses across the province. And that is because people are traveling a lot, people work in one place, they live in another. We know there's been hundreds of Canadians and people coming back to BC from around the world that may be incubating or may have early symptoms of this virus. So knowing where somebody was 2 weeks ago when we detected them is not what is going to protect you now.
Thank you. The next question is from Tanya. Tanya Fletcher, go ahead, please.
Hi, Dr. Bonnie Henry or Health Minister, either of you. We're seeing those lockdowns in California and New York now as well. So life here in BC is gradually becoming more restrictive. I know you're implementing these measures kind of gradually. To what extent are you preparing us for the eventuality of a possible shelter-in-place order?
So, there are many different ways of looking at it, and if you parse out what we're doing and what other jurisdictions are doing, I think you'll find a lot of similarities. We're all looking at the same thing. What are the things that we need to do to prevent the transmission of this virus in our communities? So we've been, I guess it takes some time to really help people work through what does this actually mean for us. And I will say that we're doing this far earlier in the trajectory here in BC and in other parts of Canada than what we have seen in many other places around the world. So the measures are actually fairly similar if we look at the details of them, and it's just called different things in different places. I will say, however, that the whole concept of shelter in place is something that we've been saying a long time now, particularly for people who are more likely to have severe illness. So our elders and seniors, people with underlying chronic conditions or disabilities that might make them more likely. I've been asking them to stay home and stay away from others, and us as a community to support those people. And we saw the initiative that Isabel McKenzie is going to be leading to make sure that we can best support those people, the people in our communities that need it most.
Thank you. The next questions would be from Marcella Bernardo, Jane Said, and Fran Yonor. Marcella, go ahead, please. Marcella Bernardo? We'll take the next question from Jane. Jane Said, are you there?
I have more questions on the Lynn Valley Care Center situation. Just to clarify, you said that, just want to clarify, first of all, the number of deaths. You say that 8 people from that care center have died, and is that 8 people from that care center? And so overall, there's been 9, I think. I just want to clarify that. And also, I'm still hearing reports of there being not adequate care for the people who are in that facility, and concerned family members saying that their loved ones aren't getting the care that they need. And I'm hoping you can comment on that.
So yes, as of this morning, we do have 8 deaths associated with the Lynn Valley Care Center, all of them residents of the Lynn Valley Care Center. And the one additional death was an elderly gentleman from in the Fraser Health area. So it is a very challenging situation. Anytime a long-term care home is in an outbreak mode, it means that there are a lot of reductions in freedoms if you will, for both the residents and the staff. It's a very stressful situation. Obviously, people are very concerned about their own health and about the health of the residents. And I know the staff at Lynn Valley care a great deal about the residents who are involved in this and are doing their very best. And Vancouver Coastal is supplementing staff on an ongoing basis and making sure that we have expertise like infection control on site every day. But it is very difficult, and very difficult for staff and for families because they cannot go in and visit. And so much of the support that we know is in our long-term care homes is given by families, and it can be very challenging.
Thank you. And another reminder to the media that please do not mute. You will not be heard unless your name is called out. The next question is from Fran Yanor. Go ahead, please.
Thank you. Hello, Dr. Henry, Mr. Dix. Thank you for your continued giving us access to so readily. Dr. Henry, you and Mr. Dix just referenced learning from other jurisdictions, and you mentioned earlier this week that the next 7 to 10 days are critical. How have the experiences and trajectories, I guess, of infection in other places informed your decision-making in terms of timing and severity of your orders, and what will we know at the end of these 10 days that you've just referenced?
Yeah, you know, I've sort of been saying it in 2-week aliquots as this outbreak has progressed around the world to a pandemic, but we're in our critical phase right now, and we've talked about how we need to continue to do the containment, particularly to manage the outbreaks very aggressively and make sure we're doing everything we can to stop transmissions, at the same time as having a whole of society social distancing, so physical separation, social connection, so that we can get through this next period of time. So we are watching very carefully, obviously understanding where the cases are arising, if they're associated with the long-term care homes, for example, with the clusters that we know of, if they're arising out in the community separately, and how we manage those. If they're still, and there are still very much numbers of people who've become ill because they've been traveling other places. So we are watching that on a daily basis. We're also working with some modeling, and early next week, as we get through this, we get some more details of the modeling. It takes time to build up the numbers and to look at where we are on the trajectory, but we are looking at that on a daily basis, and we'll be providing more details early next week for everybody else. And tomorrow I'm hoping to give some more details around some of the epidemiological parameters. So, you know, what's the age? Who are we talking about? So you have a better picture of who and how many people have been affected in our province. But it is something we watch very carefully. We're comparing where we are towards where the certain places in the U.S., France, Spain, Italy. Yeah, looking at that very carefully. It's a complex model, but we'll be kind of excited to talk about it.
Just to say, and sometimes the discussion of other jurisdictions and their differences in terms, on Tuesday we put in place the emergency measures under the Public Health Act. But far earlier than that, we developed our emergency response some weeks ago. So I think some of the changes and some of the things that have been announced in the last couple of days are things we've actually announced some time ago. These next 2 weeks are absolutely critical. These next 10 days are critical. This is our chance to flatten the curve. I laid out some of the numbers and some of the preparations we've made, but we have to continue to aggressively do the things we do to protect the population and limit the scope of the virus in BC. And so you see all of the actions that have been taken this week, which are quite extraordinary. In addition to that, we have to protect vulnerable populations, and you'll see and be seeing teams of medical officers of health and all of the health authorities taking action, in particular to protect seniors, but also other vulnerable groups in society, people who are inadequately housed, or are homeless, people who who are living with disabilities and others. So that's the second set of things. Third set of things we have to do, and we focused a lot on that today, is to continue to protect our healthcare workers because they're so important to us and there's so much on the front lines, and their confidence is so important in this process. And finally, we have to create the means and be prepared. And we listed off the numbers of acute care beds in the thousands that have been opened up really in the last week as we prepare our hospital system for the potential of many more cases coming. And we're not doing it because they're there right now. And we understand, and I think people should understand this, the cost, because there is a cost. When we cancel elective surgeries, there is a deep cost, and I have heard from people about what it means to them. And so one of the reasons why we have to flatten the curve is so we can get our healthcare system, especially on surgeries, back doing the work it did as soon as possible. And to do that, we have to be ready, and we have to be more ready than we've ever been before. But this is a huge challenge, and it's not just up to the healthcare system, it's up to everybody in the next 2 weeks to follow the very strict instructions laid out by Dr. Henry and to make sure that we're giving of ourselves 100% to this flattening of the curve.
Thank you. The next questions would be from Nicole Crescenzi, Penny Daflos, and Andrew McLeod. Nicole, go ahead, please.
Hi, Dr. Henry. Thank you for taking questions. You've been very clear about people adhering to social distancing, but I'm wondering how this would apply to funeral services. And specifically, I'm wondering if theoretically it would be possible for the deceased to transmit COVID-19 to the living, and if social distancing should also be practiced at wakes and viewings.
Yeah. So, no, we have no evidence, and this is like many other respiratory viruses. If you're not breathing, you're not transmitting it to others. And I've been working with both the coroner's service as well as the pathologist if people need to have postmortems, etc. And there's ways to do that protect those situations. But no, we don't have concerns about people being exposed to a body and being exposed to the virus, unlike some other viruses like Ebola, for example. In terms of funerals, these are gatherings where people can be at risk. If somebody has died from COVID-19, it's very likely that their close contacts may be incubating the disease. So we do have some guidance, and we talked about this with some of our faith leaders earlier this month, things to do to make sure that you can have those important rituals around a crisis like this in a safe way. So doing it, having minimal number of people perhaps there, making sure there's ways that particularly people who are older or more at risk of having severe illness, doing it remotely, having the important rituals with the family in a small number of people where you're able to keep people away. So, some of the other things, and where I come from, wakes are a really important community event, and it's very much about bringing food and being together, and those types of events need to be stalled or postponed for now. We can celebrate people's lives when we're through this crisis.
Thank you. Penny, go ahead, please.
Hi there. I think some people are a little confused in BC right now. You're saying for people to stay at home, but also the gatherings of up to 50 people are okay. And so we're seeing people in parks and public places just gathering. Isn't an order for a lockdown, shelter in place, the shutdown of non-essential businesses, a really blunt declaration essential at this point if that's where we're at in trying to curb the spread, if people just need to stay home?
Yeah, and it sounds simple, but it's not actually simple. We do need things in our economy to continue to go and to continue to move, continue to support us, to be able to get medications, to be able to get food, to have childcare, to support all of the essential work that needs to go on. So there is a difference between many of those things. So we are saying right now that, and it's not that up to 50 is okay, the order is that over 50 is forbidden, but if under 50, if you have a certain thing that needs to be done, and a funeral is a good example, you need to maintain distances, you need to maintain hygiene, you need to have other things in place to ensure that people aren't being exposed to this. And I take your point, and I talked about it earlier. This doesn't mean that it's okay to be in groups of 50 on the beach, because you're not maintaining those things that help protect us from spreading this virus. So it is a challenging message, I understand. I don't think telling everybody to stay at home is going to help us, because we do need to keep things moving, and we do need people to be out there doing the things that allow us to go to work every day. So it's finding that balance, and we'll not get it right every time, and we've been changing things as the issues come up.
Thank you. Andrew, go ahead, please.
Yeah, hi. It may have come up before, but I'm wondering if you could please address home care or home support and what particular concerns there may be with that sector, and what, if any, instructions or orders or measures have been put in place with that sector to deal with COVID-19.
So, home health care, a really important part of keeping people out of hospital, where we want to make sure that we can support people in the community so they don't need to go into hospital. And so there's been other ways that we've been trying to support that with virtual care for many places and things like that. There are also guidelines for home care nursing in particular, when they need to go in and do things in the home. So nursing and others. So there are guidelines around personal protective equipment that's needed, calling ahead, ensuring that people in the home aren't sick, making sure I'm not sick myself, taking measures like hand cleaning and minimizing the people in the room when you go into the home, etc. So yes, we do have guidance for home care workers. And again, it's finding that balance, making sure that we can care for people safely in their homes so they don't need to be in a hospital, for example.
And just to say, Andrew, that it shows we think of who's important and who's essential. Home care workers are amongst the most essential people that we have, and the work they do is more important now than ever, especially as we're supporting many seniors at home. It is an issue of critical importance, and certainly the requirements that Dr. Henry has talked about for home care workers are essential and must be followed, but also those workers are more more important than they've ever been before, and are fundamental to us dealing both with COVID-19 and with healthcare issues faced by seniors and others requiring home care, who include many people living with disabilities in BC.
Thank you. The next questions would be from Ian Mulgrew and followed by Frank. Ian, go ahead, please.
Thank you. Dr. Henry, I just was looking for clarification on a couple of issues regarding staffing and the situation around the long-term care and the other facilities where we're seeing clusters. I wonder if you could address, first of all, the staff and support staff. Are there protocols or prohibitions in place right now to prevent staff from working or moving between facilities, or are they still able to do that? And secondly, you talked about supplementing staff at Lynn Valley and elsewhere. And I wondered how many people have been seconded for that kind of relief and reinforcement, duty, and where they're coming from, since it's all hands on deck.
Right. Very good questions. The first part is, once an outbreak is declared in a long-term care home, staff are only allowed to stay in that long-term care home. But we have a broader issue that we've mentioned before about contracted workers in some parts of some sectors in in care, and the fact that they may work in many different homes on a regular basis. So we have ordered in some areas, are in the process of ordering, and I have had staff from the Ministry of Health look at how we can manage so that for all long-term care homes, particularly in the Lower Mainland, given the risk that we're seeing, the staff are assigned to a single facility only. As you can imagine, that's a complex human resources shuffling job, and that has been, we've been working on that for the last week, but it is absolutely necessary, and it's absolutely necessary to protect all the other care homes that we have, both here here in the Lower Mainland, and I'm also concerned about South Island, where there's a lot of this very similar issues. So yes, we are working on that actively. Some of the places that people have come from have been from other parts of the Health Authority, in particular for Lynn Valley and Hollyburn and Harrow Park. But also we've had a huge influx. We've had an influx of people who have recently retired, both nurses and physicians and others, healthcare professionals that have stepped up to the plate. So I know that some have been involved in this. And now with the scaling back of surgical services, there are also healthcare workers from that group who are being have volunteered and are being working with us to help supplement those issues.
Thank you. The next question is from
I don't have
Frank.
the exact number.
Okay, this is a question for Dr. Henry. Frank with Omni News. It's about mask. We know that you have advised again and again that only people who are sick should wear a mask. Healthy people should not. But I personally have seen anecdotes that people wearing masks on the street have been criticized by others for coming out with mask, which means you are sick, and the people are having that impression now, which may not be always true, and most of the time not true, and this has created some misinformation or say even trouble within our society. And the second is some epidemiologists are saying that during an epidemic like this, you have also mentioned virus is everywhere now. So we don't know who is healthy or who is not. So why not having the order to ask people wearing masks when you are at the place where there are other people in order to protect each other?
Yeah. So I'll address the second one first. And when I say the virus can be everywhere, we're not talking about, it's not in the air. It's not miasma. It's not a virus that is on surfaces, on packages. And these are some of the other things that we've been getting questions about. You know, if I get groceries, do I have to clean all my groceries? Is the virus on my groceries? Is it on my money? Is it on my a package that I got from Amazon? Those are not things that are at risk of infecting you. Those are things where, yes, when you handle them, you should wash your hands and clean your hands, and that will kill the virus. In terms of, so, you know, us all wearing masks is a colossal waste of masks, and we know that people who aren't ill and are wearing a mask often fiddle with their face, and that can be a risk for them self-inoculating and becoming ill. So that's part of our rationale. We need to keep the masks for where they're needed, and I do recognize, however, and we've talked about this before as well, I do recognize that it is an expectation and a symbol of respect in some societies that you wear a mask when you're out to protect others, and I respect that. And I have messaged to people that we should not be criticizing people who are walking around wearing a mask, because it's part of their beliefs and their way of doing things. I don't think it's necessary, and I will continue to say it's not necessary unless you're sick yourself, in which case a mask can keep those droplets in, and it's important if you do need to go out for urgent things like going to a medical appointment.
Thank you. The next questions are from Lorraine Graves, followed by Sandy Hall and Megan Bevlin. Lorraine, go ahead, please.
Hi, I'm with the Richmond Sentinel, and we've been hearing that there are cases out here where we haven't had that confirmed, where they acquired through travel or community. We had a young adult recently told by a physician out here, you can't have it because you've been in Richmond all this time, and so you haven't been exposed. So that's why we need to know a little bit more about the Richmond cases.
Yeah, so I don't know where all of the cases are. As you know, we're now up to several hundred. But we know they're in communities all around the province. There's no health authority that has not had people. We know that people travel a lot, and you know, I don't know everybody in Richmond who's been outside the country in the last little while, and that's the message that's most important. And you know, the clinician in Richmond needs to understand now that we have this in our communities and we need to be aware of it. And most importantly, if you're sick, even if you don't have this, and even if your risk may be very low for this, anybody in our province who has a respiratory illness, who has a runny nose, a sore throat, a cough, shortness of breath, a fever, needs to stay home. They need to self-isolate, stay away from others, stay away from the people in your home as much as possible, because you can spread this to others. And that's the barrier that we need to create right now. And it's what we're doing for people. We're requiring people who've traveled outside the country to do that for 14 days. I would encourage anybody who has who's ill right now, you stay home, you self-isolate. You can use our online symptom checker, and it will give you advice about how long you need to stay in and whether you need to be tested or not.
Thank you. The next question, Sandy Hall. Sandy, go ahead, please.
I have a question about COVID response mobile testing unit being launched in Langford. I don't think this is a public health initiative. They'll be going to houses with mobile nurses and doing testing. I'm wondering if that's something you support.
I don't at the moment. You know, I'm not sure I understand why somebody would do that in Langford. Where I do see a need that I think that type of a service might be helpful for is for people in that community who don't have access maybe to healthcare, who are sick, who are concerned, to be able to talk with somebody to help them through, people who, to help them with what I just talked about self-isolation if I'm sick. So if I'm somebody who's recently come back from Mexico and I have symptoms, you know, having a healthcare provider who can walk me through what I need to do to stay home. And then if I get sicker, having someone I can connect to if I need to go to hospital, for example. And that's a service that I think would be great. As we've mentioned, we've changed our testing strategy to make sure that we can more effectively target the highest risk and the high priority tests. So somebody randomly doing tests in Langford would not meet the priority criteria necessarily. So I don't think that's a good use of resources.
Thank you. We have time for a couple more questions. Megan Devlin, and then we'll wrap up with Brittany Webster from AM 1150. Megan, go ahead, please.
Hi. What do you recommend people tell their friends and family who are not obeying the social distancing rules? Like, how can we get that message across to people in our lives who are the ones gathering on beaches, for example?
Yeah, it's a really good question, because, you know, I see when I've been walking around by myself here, you know, there's a lot of young people, and young people feel like they're immune to this, perhaps. More information is coming out that young people are certainly not immune, as I have said many times. You know, under 19 tend not to get as sick, not to get infected even with this virus, and that's fine. But people in their 20s and 30s do get pneumonia with this, and sometimes can get seriously ill. So I would encourage people to use social media, to call people out, to say, you know, this is what we need to do now. We need to keep our germs to ourselves. We need to have small groups. We need to go online. And, you know, I look at the young people in my life, and they spend all their time texting each other, and they're sitting right next to each other anyway. So, you know, let's do that for now, because the people we're going to bring it home to are the people that are closest to us. And that may be our grandparents, that may be our parents, that may be somebody in our life whose immune system is compromised.
Thank you. And we'll wrap up today's presser with the last question from Brittany Webster. Brittany, go ahead, please.
Hi there. First off, I want to ask about a woman in Vernon. She has recently taken to Facebook to say that she has severe enough symptoms that her doctor has given her their personal cell phone number, but she is not being tested unless her symptoms get worse. So could someone just reiterate what the, I guess, testing protocols are for who is being tested? And I want to ask about a petition on change.org that's going around that was initiated by several doctors across the country for the government to initiate warlike efforts to assist frontline healthcare workers. Can someone speak to that as well, please?
Sure. For the first scenario, I mean, that is what we're saying for everybody who's a returning traveler. And the important thing for this is trying to make sure that you are not going to pass it on to anybody else. Obviously, we want to make sure that your health is not seriously affected, and for most people it is something that they can manage at home. So I'm really heartened that her physician is continuing to connect with her, and if her symptoms get to the point where she needs hospital care, then that needs to be done safely. She calls ahead, she makes sure that they know that she has these respiratory symptoms, and then anybody who is in hospital or needing hospital care will be tested for this for sure. That's part of our priority because we want to make sure we know what we're dealing with, and it will change their management if she may be sick with something else that may require additional or different treatments. So that's part of the protocols, and the focus right now is on testing people who are part of our outbreaks, including healthcare workers and any healthcare workers, so we can make sure that it's not going to be transmitted in a healthcare setting and that people can get back to work, as well as outbreaks, clusters of cases, and long-term care facilities. So those are the main focus right now. We know that there are a number of people, hundreds of people in BC right now who are at risk because of travel and because of particularly because of travel, and most of them will have mild symptoms, and what we need them to do is to self-isolate, to stay at home so they're not passing it on to anybody else. The second question was about the war footing, and I actually think our federal government has started to take some of those actions where they've asked industry to repurpose some of their manufacturing, where they've been taking some of those measures, and I don't know if you want to talk to that.
I just want to say with respect to that, with respect to anybody, young or old, who isn't taking this seriously, we need all of us to be the voice of the BC Centre for Disease Control, to be the voice of Dr. Bonnie Henry, to be the voice of all those doctors and nurses and care aides who are going to take care of people. We need everybody to be the voice right now, and especially our elders, our grandparents and our parents and all our community, all those who are vulnerable in our community. We've got to be their voice. And we need, let's talk about voluntary and not voluntary. There isn't anything voluntary here. We all have to do this. We need 100% compliance, and we know in some areas it's easier to enforce compliance than others, and we've seen some mayors acting today, and I think that's a good thing. But we need everyone to consider this and have 100% compliance. With respect to the idea of war, we do need to ensure that essential services are operating, and that means that a whole bunch of people, not just healthcare workers, are essential in the economy, and allowing the economy to function and all of us to function and having the goods and services we need to self-isolate is a critical part of what we want to do. The federal government has talked about repurposing some manufacturing, and we're looking at that as well to ensure that we have the equipment that we need, that our healthcare workers need, that others need to stay safe, and that's important. But I just want to reiterate what we said in the briefing about this, that we have in acute care hospitals today 2,398 people under our occupancy, our previous occupancy prior to COVID-19, 2,398. In critical care units, 246 less in critical care. These are extraordinary measures, and we are just starting them. And the largest bolus of elective surgeries that will be canceled will start next Monday. So these numbers are likely to increase. And right now, we have, as we said, 22 cases in acute care. So these are dramatic responses from the healthcare system that tell you how seriously we take this. And whether people asked last night, they asked Dr. Henry, they asked myself last night and yesterday, they've asked all the time, is it enough? Well, we have to bend the curve. That's what makes it enough. And that's why we need 100% compliance. So whatever metaphor that people want, we need from everybody 100%, and we need it now. Thank you very much.
Thank you all for participating.